Wallowa County's first hospitals were small facilities, connected to the homes of physicians. At one point, there were 6 hospitals in the county, with 2 each in Wallowa, Enterprise, and Joseph. In the early 1940s, then Wallowa County chieftain, editor, and publisher Gwen Coffin and other community leaders looked into the possibility of building a new hospital. That dream seemed over when voters rejected a bond measure to support a modern hospital, but a scathing editorial by Coffin turned the tide. "We hope that when some of those who fought to kill the hospital stand beside some of their loved ones dying," wrote Coffin, "they will find the satisfaction and comfort they will need by fondling the few dollars in their pocket which they saved by killing the best chance Wallowa County ever had to have a modern hospital." The editorial inspired private contributions to raise the $22,000 needed until a subsequent levy could be passed. The first new hospital and an adjacent nursing home opened in 1950 at a cost of $250,000. But by the end of the century, it was clear it was time to consider a new hospital once again. In the mid-80s, Dr. Lowell Ewis and Dr. Scott Seavey were handling the majority of the county's patients. Working 80-plus-hour weeks, they were overwhelmed and struggled to recruit new physicians. In 1988, they hosted a summit in Joseph to address the rural healthcare crisis. State Representative Mike Thorn brought the issue to the legislature and enlisted top leaders from the medical school community, including Dr. John Saultz, a young professor at Oregon Health Sciences University. A $5,000 tax credit to rural doctors and dentists was passed, and OHSU launched the Rural Rotation Program, requiring medical residents to rotate for 6 to 8 weeks through a rural community with the hope that some would choose a rural practice. Dr. Ewis soon saw the need to form a healthcare foundation. He called community leaders, and 7 agreed to serve on the board and give $1,000 of their own money to get it off the ground. In 1991, the Wallowa Valley Healthcare Foundation was born. The Rural Rotation Program was underway, but the visiting residents needed a place to stay. Dr. Ewis pleaded to the foundation to raise money for a small house for the residents. And so in November of 1996, the first Healthy Futures dinner auction was born. The event raised over $19,000 toward the residents' house and became an annual tradition. But healthcare in Wallowa County was not out of the woods. Although a third physician, Dr. Devee Boyd, had joined Ewis and Seavey, they still worked long hours, and it was becoming increasingly clear that the once modern hospital was no longer meeting the community's needs. The hospital was down to just 7 days of cash on hand and was carrying debt of over $2 million. Equipment was old and needed to be replaced. The effort to turn the crisis around at the hospital began in 2001 when the healthcare district hired Larry Devee to serve as hospital administrator, and it culminated 6 years later when the new hospital, built at a cost of $23 million, was unveiled on March 11, 2007. By then, Dr. Renee Grandy and Dr. Liz Powers, a rural resident, had joined the medical staff. "I am extremely proud of Wallowa County," said Dr. John Saultz. "The formation of the foundation has had a profound and lasting impact." Said Dr. Ewis, "The foundation and the Healthy Futures dinner auction have contributed a great amount to healthcare. He, along with Dr. Seavey and Dr. Boyd, are happily enjoying retirement." The county is now served by 12 physicians, 5 of them from the Rural Rotation Program.